Hello everyone, this is Albert and I am going over a section of the Medicare and You book, and this section is page 86, What If I Need Help Paying My Medicare Healthcare Costs? So join me, page 86, here we go. Medicare Savings Programs. If you have limited income and resources, you may be able to get extra help from your state to pay your Medicare costs if you meet certain conditions. There are 4 kinds of Medicare savings programs. Number 1, Qualified Medicare Beneficiary Program, otherwise known as QMB. If you're eligible, the QMB program helps pay for your Part A and your Part B premiums. In addition, Medicare providers are not allowed to bill you for services and items Medicare covers, including deductibles, coinsurance, and co-payments, except outpatient prescription drugs. If you get a bill for these charges, tell your provider or debt collector that you're in the QMB program and cannot be charged for items and services Medicare covers, including deductibles, coinsurance, and co-payments. If you've already made payments on a bill for services and items Medicare covers, you have the right to a refund. Note, to make sure your provider knows you're in the QMB program, show both your Medicare and Medicaid or QMB card each time you get care. That's important. Show your Medicare card and your Medicaid card. You can also give your provider a copy of the Medicare Summary Notice, MSN. Your MSN will show you're in the QMB program and you should not be billed. Log into your mymedicare.gov account at any time to view your MSN or sign up to get your MSNs electronically. If your provider won't stop billing you, call us at 1-800-MEDICARE. Okay, continuing. Number 2. This is number 2 of 4 programs. Specified Low-Income Medicare Beneficiary Program, SLMB. Helps pay for your Part B premiums. Remember, Part B is $144.60 this year. So the SLMB program will pay that for you. Number 3, Qualifying Individual QI Program. It also helps for the Part B premiums only. Funding for QI benefits is limited and the applications are granted on a first-come, first-served basis. Item number 4, program number 4, Qualified Disabled and Working Individuals, QDWI program. Helps pay for your Part A premiums only. You may qualify for this program if you have a disability and are working. In the blue box, if you qualify for QMB, SLMB, or QI1 program, you automatically qualify for extra help paying for Medicare prescription drug coverage. See pages 83 and 85. That was the previous video that I have, so please go back one if you want to review what extra help is. Important. The names of these programs and how they work may vary by state. Medicare savings programs aren't available in Puerto Rico or the U.S. Virgin Islands. So these 4 programs are called Medicare savings programs. Now, how do I qualify? In most cases, to qualify for a Medicare savings program, you must have income and resources below a certain limit. States have different limits and ways of counting your income and resources, so you should check with your state Medicaid office to see if you qualify. For more information, call or visit your Medicaid office, your state medical assistance office, and ask for information about Medicare savings programs. To get the phone number for your state, visit medicare.gov/contacts. You can also call 1-800-MEDICARE. Now, let's continue. Medicaid. Medicaid is a joint federal and state program that helps pay health care costs if you have limited income and resources and meet other requirements. Some people qualify for both Medicare and Medicaid. What does Medicaid cover? Bullet 1. If you have Medicare and full Medicaid coverage, most of your health care costs are covered. You can get your Medicare coverage through Original Medicare or a Medicare Advantage plan. So you can have one or the other. Number 2, second bullet. If you have Medicare and or full Medicaid coverage, Medicare covers your Part D prescription drugs. Medicaid may still cover some drugs that Medicare does not cover. Third bullet, People with Medicaid may get coverage for services that Medicare doesn't cover or only partially covers, like nursing home care, personal care, transportation to medical services, home and community-based services, and dental, vision, and hearing services. So that's very interesting to know. How do I qualify? Medicaid programs vary from state to state. They may also have different names like medical assistance or Medi-Cal. Each state has different income and resource requirements. In most cases, you need to be enrolled in Medicare if eligible to get Medicaid. Call your Medicaid office for more information and to see if you qualify. Visit medicare.gov/contacts or call 1-800-MEDICARE. That was Medicaid. Now, the next kind of program that they have is a demonstration plans for people who have both Medicare and Medicaid. Medicare is working with some states and health plans to offer demonstration plans for certain people who have both Medicare and Medicaid, called Medicare Medicaid plans. If you're interested in joining a Medicare Medicaid plan, visit medicare.gov/plan-compare to see if one is available in your area and if you qualify. So now we're moving on this page, still page 87, State Pharmacy Assistant Programs, SPAPs. Many states have SAPAPs that help certain people pay for prescription drugs based on financial need, age, or medical condition. To find out if there's an SPAP in your state and how it works, call your state health insurance assistance program. See pages 109 through 112 for the phone number. Now we're on page 88. Pharmaceutical assistance programs, also called patient assistance programs. Many major drug manufacturers offer assistance programs for people with Medicare drug coverage who meet certain requirements. Visit medicare.gov/pharmaceutical-assistance-program to learn more about pharmaceutical assistance programs. Lots of help out there. You just have to look. Programs of all-inclusive care for the elderly, otherwise called PACE. PACE is a Medicare and Medicaid program offered in many states that allows people who need a nursing home level of care to remain in the community. See page 68 for information. So that's what I love about the Medicare and You book. It tells you where to go and where to find the answers. Now, the next program is Supplemental Security Income, otherwise known as SSI. SSI is a cash benefit paid by Social Security to people with limited income and resources who are blind, 65 or older, or have a disability. SSI benefits aren't the same as Social Security retirement benefits. You may be able to get both SSI benefits and Social Security benefits at the same time if your Social Security benefit is less than the SSI benefit amount. Due to a limited work history, a history of low-wage work, or both, if you're eligible for SSI, you automatically qualify for extra help and are usually eligible for Medicaid. You can visit benefits.gov/SSA and use the benefit eligibility screening tool to find out if you're eligible for SSI or other benefits. You can call Social Security at 1-800-772-1213 or contact your local Social Security office for information. Note, people who live in Puerto Rico, the U.S. Virgin Islands, Guam, or American Samoa cannot get SSI. Next program, programs for people who live in the U.S. territories. There are programs in Puerto Rico, the U.S. Virgin Islands, Guam, the Northern Mariana Islands, and American Samoa to help people with limited income and resources pay their Medicare costs. Programs vary in these areas. Call your Medicaid office, state medical assistance office to learn more. Visit medicare.gov/contacts or call 1-800-MEDICARE. And that concludes this portion of assistance programs available according to the Medicare and You book. What if I need help paying for my Medicare healthcare costs? Thank you so much. I appreciate your time and patience, as I know these are long presentations. This is a long presentation, and it has a lot of information of value to you. Thanks.